Inflammation is a complex biological response of our body to harmful stimuli, such as pathogens, damaged cells, or irritants. Imagine your body as a fortress, and inflammation as its brave army, always ready to defend against invaders and heal wounds. This protective response is crucial for our survival, playing a vital role in removing harmful agents, initiating the healing process, and restoring the body's balance. However, like a double-edged sword, uncontrolled or chronic inflammation can be detrimental, contributing to various diseases. Inflammation is characterized by 5 cardinal signs: redness, heat, swelling, pain, and loss of function. These signs are a direct result of the changes occurring at the microscopic level, where blood vessels dilate, allowing more blood flow to the injured area, hence the redness and heat. This increased blood flow also leads to the leakage of fluid and cells from the blood vessels into the surrounding tissues, causing swelling. The pain is caused by the release of chemical mediators that irritate nerve endings. Understanding the different morphological patterns of inflammation, the characteristic changes in tissue structure observed under a microscope, is critical for understanding the underlying cause of inflammation, its severity, and its potential consequences. This knowledge enables healthcare professionals to make accurate diagnoses, predict disease progression, and develop effective treatment strategies tailored to the specific type of inflammation. Acute inflammation is the initial rapid response to injury or infection. It is a short-term process, lasting from a few hours to a few days, characterized by the rapid accumulation of fluid, plasma proteins, and neutrophils at the site of injury. This process is like sending the first responders to the scene of an accident. Neutrophils, the most abundant type of white blood cell, are like the paramedics, rushing to the site to engulf and eliminate the harmful agents like bacteria or debris. Acute inflammation manifests clinically with the classic signs of inflammation: redness, heat, swelling, pain, and loss of function. Think of a time you accidentally cut yourself. The area around the cut likely became red, swollen, and painful. These are all signs of acute inflammation, your body's way of containing the injury and starting the healing process. The pain and swelling serve as protective mechanisms, limiting the use of the injured area and allowing it to rest and heal. Acute inflammation can be triggered by a variety of stimuli, including infections, trauma, physical and chemical agents, tissue necrosis, and foreign bodies. The outcome of acute inflammation depends on the cause and severity of the injury and the body's ability to mount an effective response. In most cases, acute inflammation successfully eliminates the harmful stimulus, and the body returns to its normal state. However, in some instances, acute inflammation can progress to chronic inflammation, a long-term condition with potentially serious consequences. Chronic inflammation is a prolonged inflammatory response that lasts for weeks, months, or even years. Unlike acute inflammation, which is characterized by a rapid onset and a short duration, chronic inflammation is a slow, smoldering process that can persist even after the initial trigger is gone. Imagine a fire that, instead of being extinguished quickly, continues to smolder for a long time, causing ongoing damage. This persistent inflammation can lead to tissue damage and scarring as the body tries to repair the injured area repeatedly. Instead of neutrophils, which are the key players in acute inflammation, chronic inflammation involves others such as macrophages and lymphocytes. Macrophages are like the cleanup crew, removing cellular debris and dead cells. Lymphocytes, on the other hand, are part of the adaptive immune system, mounting a specific response to the perceived threat. Chronic inflammation is associated with a wide range of diseases, including arthritis, asthma, cardiovascular diseases, and even cancer. The constant presence of inflammatory mediators can damage DNA, promote abnormal cell growth, and contribute to the development of chronic diseases. Understanding the mechanisms of chronic inflammation is crucial for developing effective therapies for these debilitating conditions. Granulomatous inflammation is a specific type of chronic inflammation characterized by the formation of granulomas, small nodular collections of specialized immune cells called macrophages. These granulomas are like tiny fortresses built by the body to contain substances that are difficult to eliminate, such as foreign bodies or certain types of bacteria. Imagine a splinter embedded in your finger. Your body, unable to break down the splinter, forms a granuloma around it to isolate it from the surrounding tissue, preventing it from spreading and causing further damage. The macrophages within the granuloma work tirelessly, attempting to engulf and digest the foreign material. Granulomatous inflammation is a hallmark of certain infectious diseases, such as tuberculosis and leprosy, where the body uses this mechanism to wall off the invading bacteria. It can also occur in response to foreign bodies, such as splinters or sutures, and in some autoimmune diseases, like Crohn's disease and sarcoidosis, where the immune system mistakenly attacks the body's own tissues. Understanding the causes and characteristics of granulomatous inflammation is crucial for diagnosing and treating these conditions effectively. GAP3S. In this chapter, we delve into the cellular mechanisms behind inflammation. We will explore how cells resist to injury and infection. Detailed animations and diagrams will illustrate these complex processes, making them easy to understand. GAP2S. When the body encounters an injury or pathogen, a series of cellular events is triggered. The first responders are often the neutrophils, which are the most abundant type of white blood cells. They rush to the site of injury, guided by chemical signals known as chemokines. GAP2S. Neutrophils are adept at phagocytosis, engulfing and digesting pathogens and debris. They release enzymes and reactive oxygen species to neutralize the threat. However, their actions can also cause collateral damage to surrounding tissues. GAP2S. Next, macrophages arrive at the scene. These cells are versatile. They can engulf pathogens like neutrophils, but also play a crucial role in orchestrating the inflammatory response. They release cytokines, which are signaling molecules that recruit other immune cells to the site and enhance the inflammatory response. GAP2S. One of the key players in chronic inflammation is the T lymphocyte. These cells are part of the adaptive immune system, providing a more targeted response. They recognize specific antigens presented by macrophages and other antigen-presenting cells. Once activated, T lymphocytes proliferate and release cytokines that sustain the inflammatory response. GAP2S. Another important cell type is the B lymphocyte, which produces antibodies. These antibodies bind to pathogens, marking them for destruction by other immune cells. B lymphocytes also play a role in the formation of memory cells, which provide long-term immunity. GAP2S. The endothelium, the inner lining of blood vessels, also plays a significant role in inflammation. It becomes more permeable during inflammation, allowing immune cells to exit the bloodstream and enter the affected tissue. This process is regulated by various signaling molecules, including histamines and prostaglandins. GAP2S. Understanding these cellular developing targeted therapies for inflammatory diseases. By modulating the actions of specific cells and signaling pathways, we can potentially reduce harmful inflammation while preserving the body's ability to fight infections and heal injuries. GAP2S. In our next chapter, we will explore how these cellular mechanisms can sometimes go awry, leading to chronic inflammation and autoimmune diseases. Cytokines play a crucial role in the inflammatory response. In this chapter, we will discuss the different types of cytokines, their functions, and how they influence the behavior of immune cells. Detailed animations and diagrams will help visualize these interactions. GAP2S. Cytokines are small proteins released by cells, particularly those of the immune system. They act as messengers, coordinating the body's response to infection and injury. There are several types of cytokines, including interleukins, interferons, and tumor necrosis factors, each with unique roles in the immune response. GAP2S. Interleukins are a group of cytokines that facilitate communication between white blood cells. They can promote the growth and differentiation of T and B lymphocytes, enhancing the body's ability to fight off pathogens. Some interleukins also play a role in regulating inflammation and promoting tissue repair. Interferons are another type of cytokine, primarily involved in the body's defense against viral infections. They interfere with viral replication and activate immune cells, such as natural killer cells and macrophages, to eliminate infected cells. Interferons also boost the presentation of antigens to T cells, enhancing the adaptive immune response. Tumor necrosis factors, TNFs, are cytokines that can induce cell death or apoptosis in infected or cancerous cells. TNFs also play a role in promoting inflammation and recruiting immune cells to the site of infection or injury. However, excessive TNF production can lead to chronic inflammation and tissue damage, highlighting the need for a balanced set of cytokines that specifically attract immune cells to the site of infection or injury. They create a chemical gradient that guides neutrophils, macrophages, and other immune cells to the affected area, ensuring a rapid and targeted response. Cytokines can have both pro-inflammatory and anti-inflammatory effects. Pro-inflammatory cytokines, such as interleukin-1 and TNF-alpha, promote inflammation and recruit immune cells to the site of infection or injury. Anti-inflammatory cytokines, such as interleukin-10 and transforming growth factor beta, help resolve inflammation and promote tissue repair. The balance between pro-inflammatory and anti-inflammatory cytokines is crucial for maintaining a healthy immune response. An imbalance can lead to chronic inflammation, autoimmune diseases, or an inadequate response to infections. Understanding the role of cytokines in the immune response is essential for developing targeted therapies for inflammatory and autoimmune diseases. By modulating cytokine activity, we can potentially reduce harmful inflammation and restore immune balance. In our next chapter, we will explore how these cellular mechanisms can sometimes go awry, leading to chronic inflammation and autoimmune diseases. Stay tuned to learn more about the delicate balance of the immune system and how it can be restored. Chronic inflammation can have a profound impact on the body, leading to various diseases and conditions. In this chapter, we will explore the long-term effects of chronic inflammation and the underlying mechanisms. Detailed animations and diagrams will illustrate these concepts. GAP2S. Chronic inflammation is like a slow-burning fire within the body. Unlike acute inflammation, which is a short-term response to injury or infection, chronic inflammation persists over time and can cause significant damage to tissues and organs. GAP2S. One of the most well-known consequences of chronic inflammation is cardiovascular disease. Persistent inflammation can lead to the buildup of plaque in the arteries, a condition known as atherosclerosis. This can increase the risk of heart attacks. Inflammation is also linked to metabolic disorders such as diabetes. Inflammatory cytokines can interfere with insulin signaling, leading to insulin resistance and elevated blood sugar levels. Over time, this can result in type 2 diabetes and its associated complications. Another area where chronic inflammation plays a critical role is in autoimmune diseases. In conditions like rheumatoid arthritis and lupus, the immune system mistakenly attacks the body's own tissues, causing prolonged inflammation and tissue damage. The digestive system is not immune to the effects of chronic inflammation either. Conditions such as inflammatory bowel disease, IBD, which includes Crohn's disease and ulcerative colitis, are characterized by chronic inflammation of the gastrointestinal tract, leading to pain, malnutrition, and an increased risk of colorectal cancer. GAP2S. Even the brain can be affected by chronic inflammation. Neuroinflammation is associated with neurodegenerative diseases, such as Alzheimer's and Parkinson's. Inflammatory cytokines can damage neurons and disrupt normal brain function, contributing to cognitive decline and other neurological symptoms. GAP2S. Understanding the mechanisms behind chronic inflammation is crucial for developing effective treatments. Researchers are exploring various strategies to modulate the immune response and reduce inflammation, including the use of anti-inflammatory drugs, lifestyle changes, and dietary interventions. In chronic inflammation, we can potentially prevent or alleviate a wide range of diseases, improving overall health and quality of life. However, achieving this requires a delicate balance, as suppressing the immune system too much can leave the body vulnerable to infections and other threats. In our next chapter, we will delve into the latest advancements in anti-inflammatory therapies and how they are being used to tackle chronic inflammation. Stay tuned to learn about the promising treatments that could revolutionize the way we manage inflammatory diseases. In this final chapter, we will summarize the key points discussed throughout the video and explore potential therapeutic approaches to managing journey. We have seen how inflammation, both acute and chronic, plays a critical role in the body's defense mechanisms, the rapid response to injury, and the prolonged battles against pathogens. Delved into the specialized defense mechanisms and cellular processes that drive inflammation, and we examined the crucial role of cytokines in orchestrating these responses. More importantly, we explored the significant impact chronic inflammation can have on our health, contributing to a range of diseases from cardiovascular disease and diabetes to autoimmune disorders and neurodegenerative conditions. GAP2S. Understanding these mechanisms is essential for developing effective treatments. Current therapeutic approaches include the use of anti-inflammatory drugs, such as NSAIDs and corticosteroids, which help reduce inflammation and alleviate symptoms. Researchers are also exploring emerging therapies that target specific pathways involved in inflammation. Biologic agents, for example, are designed to inhibit the activity of specific cytokines or immune cells, offering a more targeted approach to treatment. GAP2S. Lifestyle changes and dietary interventions are also crucial in managing inflammation. Regular physical activity, a balanced diet rich in anti-inflammatory foods, and stress management can all help reduce chronic inflammation and improve overall health. GAP2S. Additionally, novel treatments such as gene therapy and personalized medicine hold promise for the future. These cutting-edge approaches aim to tailor treatments to individual patients, potentially revolutionizing the way we manage inflammatory diseases. By addressing inflammation through a combination of traditional and innovative therapies, we can improve health outcomes and enhance quality of life for those affected by chronic inflammation. Thank you for joining us on this journey through the fascinating world of inflammation. Stay informed, stay healthy, and remember that understanding the body's defense mechanisms is the first step towards achieving better health and well-being.